Okay, recording in progress. Am
Hmm.
I good still for this?
Yeah, you got it closer though.
Like this close?
I mean, it's interesting. It's not even that loud when you're
And
running.
when you're back, there's like a ticking sound as well, but when you're closer, there's not. Like right now.
Better now?
Mm-hmm.
I'm just not going to use the microphone then.
No,
Yeah, it's
that's
actually
fine.
better.
It's much better.
Yeah.
I'm glad I spent that money.
Is it the furnace is about to explode that we can hear in the background?
Yeah, that's it.
It's asking her for a passcode.
Oh my goodness. Just tell her to click on the link. Join Zoom meeting.
Yeah.
I don't know. Hold on.
Passcode 794-711. Is she calling in?
No, somebody just, oh, she texted you too. Good. I don't know what she's doing. What she's doing.
Hmm.
I didn't want her on this call anyway.
Nice.
Just kidding.
Oh my god.
Some people have problems all the time. Like I'm at, jeez,
There. She's on. She's
like
connecting.
attention seeker.
I don't wanna
No,
set off
she
on the
made
wrong
it.
note, but why does everyone have the
wow.
correct Zoom link except for me each
Hey,
time?
hey, don't
have
be
the correct
starting
one.
to dig up
This is it.
excuses.
Hi
Well,
guys.
Just said I didn't want you.
Good morning, Laurel. It's good to see you.
You too. Thanks for letting me in.
Podcast is over. We've already done the interview. It's
Already
over.
done.
Great.
I hope you summed everything up beautifully for me.
Yes.
I knew you would.
Okay.
Okay.
Coming at you.
Jeez.
Hey.
Wish I had my microphone.
There's like
Oh.
a
it
little
sounds
echo
fine.
thing. Oh, does she? Okay, maybe it's just on my end.
Do you hear an echo?
Elizabeth, talk.
Do you hear an echo, Gina? Because that's just the way it's going to be if you hear an echo.
Okay, I don't hear it right now.
I don't hear one.
I didn't.
It's good. It's
You guys
good.
ready?
I think so.
You think so? Okay.
Okay,
Here
so
we
do you have any
go.
questions? Any questions, any concerns before we begin?
Nope. I'm not gonna say anything. I'm just here for support.
Why does he say that?
Maybe you could answer
Perfect.
some star questions, huh?
Yeah.
No, she said
Maybe.
it's not a star session, so I can't say anything, you know.
It is a star session.
I think we should just ask Jill all the
Otherwise
questions.
we'll ramble for 2 hours.
Right.
Horrible attitude.
Yep. Here we go. It's gonna be difficult, I can tell.
Yeah.
This is going to be the best podcast.
Yep.
All right, Lizzo.
Just a minute. There's something here.
Let's
I'm
go.
trying-
We
Wait,
should
just a
keep the
minute.
date. You guys are not ready. You know, let's do another date.
Hey man, I've been ready.
Okay,
Right.
here, just a minute. Almost there. You guys can
Wait,
talk.
it's really raining here.
No, it's
Really
gross here
raining.
too.
Ah,
I feel
Well,
like maybe we were supposed to wear a hat, Gina,
I know. You can get the memo.
or the Zoom link.
look at I got all my CMT
Well, I got
stuff. I
that.
got my
You-
hat.
Everyone
I have my
same
coffee
Zoom
mug.
link, Laurel.
It's
Everybody.
early in the morning here. Remember, it's early in the morning where I am.
Well, I'm glad you came.
Yes, it's very.
All right. Let's
I
go.
would miss it.
You ready? You
Chris,
guys have any questions?
Any extra light there for you because we do this on
No.
why even
That's-
ask?
Hmm.
Well, I do have a light that goes on my computer, but everything else is plugged in. So
That's better. That's a little bit better.
Okay.
Okay, we're excited. We're gonna get snowed in tomorrow morning.
yep, it's gonna
Are
be
you?
nice.
Yeah,
Oh,
12 to 18 in
wow.
Burlington.
but Johan has to. So no questions. Yeah, it's gonna be bad.
Oh, geez.
All right, you ready, Lizzo?
I am. So we're gonna go back and forth, and then you know how it goes.
Yeah. Okay, you recording? Gina, you stretching?
Yeah, I got it.
Jesus. Chill. Yep, good. All right. Wow.
I just read your thing, Chris, that you wrote. Just
Yeah. Awesome. All true stories.
let's go.
All right. 1, 2, 3. Hello, everyone. This is Chris and Lizzo.
We are a brother-sister team.
And on behalf of the Charcot-Marie Tooth Association, aka CMTA, we are coming at you.
And at you from coast to coast.
Jesus.
I am from California. Chris is in Vermont, but right now I am in Vermont too.
And this is another episode of our podcast name. What, Lizzo?
CMT for me. CMT, the number 4, me.
That's right, folks. CMT for me, a community-focused podcast dedicated to those with CMT, giving them a voice in the community to share their stories, good or bad, successes, challenges, and much, much more.
Hey, Chris, before we
What's
get
up?
into nitty gritty of this
What's
podcast,
up?
I just wanted to say that the last 2 weeks in Vermont have been crazier than an outhouse fly.
Yeah, what the heck's an outhouse fly? But I would agree with you. It is crazy.
It's been nuts.
Well, give us nuts, nuttier than a 5-pound fruitcake. No. So give us some insight, Lizzo. Give us some insight. Why is it like an outhouse fly here in good old VT?
Well, I have to say that last night, Johan was up all night throwing up.
Oh, awesome.
We
Good.
started the trip with this old lady. I had all my stuff in the carry-on bin. She comes down the aisle. Everybody's yelling at each other in San Francisco and everything. She grabs my stuff, throws it on the front seat, taking my stuff out. Whoops.
Whoa, jeez. Hey, producer, make sure and edit that out. No swearing on the
My
podcast.
stuff out. And I'm like, what are you doing? So I had to put it all back up, and she had attitude, man. Then we got here, and my furnace has been going the
what?
whole time.
Whistling?
Whistling, just whistling. The guy came, fixed it,
Yeah,
but there
right.
was a hole in it. All this smoke coming out. Whoa, all this smoke coming out. I just opened a bottle of Sprite for Johan, who's been sick all night. Opened it. The guy, the Uber driver, must have shook it. Sugar water all over me, all over my face, all over the kitchen. And then going over to Mom's house has been crazy, getting the automatic feeder. It's just been one thing after another, nonstop.
Yeah. Well, a really nice thing at their house, right? Don't you like the inside temperature?
Yeah, it's like 90 degrees. And then you're trying to clean bathrooms and clean stuff. And Johan's like, I'm going to pass out. I'm like, shh, just sit there and play with the cat. And it's like being in a sauna and trying to do everything like normal. And I'm like, Mom, wear a sweater. Oh no, I don't like anything on my, I just like to wear the blouse. In the meantime, everybody's just taking all their clothes off. It's just so hot.
Nice.
How's your week gone?
What's that?
How has your week gone?
No, pretty crazy as well. Mine was
Me?
pretty good. So woke up, hard day at work. I'm like, let's go skiing Saturday afternoon, Mia and I. Well, Mia's up Friday night because Lila's in New York City out with her friends, got her phone stolen. So she's in panic mode. So Mia starts dealing with getting Lila a new phone in New York City. She's traveling all around Manhattan trying to find a iPhone, whatever. They finally get it connected. And Warren and Lila have similar phone numbers. So Warren's at work. They accidentally disconnect Warren's phone. So he's like, hey, what the hell's going on? I don't have any service here. So he's the innocent guy. And now he's taking a beating. And it's just been crazy, just crazy. And now, the cool thing is I'm getting involved with Mom and Dick's and Dad's inspections. So you go into these homes. I almost got attacked by a dog. Some old guy won't turn his lights on. He has a cane. He's 92. I thought he was going to whack me and lock the door and I was going to get killed. And then I leave these places smelling like smoke. I'm wheezing and, pretty crazy here. But, that's the way it goes. That is the way it goes.
I think you had, you told me about an experience. You had some woman thought.
Oh, yeah. And then I'm leaving. I go into the apartment, do the inspection. The woman's like, oh, you're Bevan Dick's daughter. And I'm like, whoa, hold on a second. My name's Chris, not Christine. So had to straighten her out. And then on top of that, not skiing, I'm like, well, I will get a Christmas tree. I will get a Christmas tree. We have just over 2 weeks. Drive down, no trees on the lot. Sold out. Awesome. Still don't have a tree. So anyways,
And we're gonna get
Psyched.
dumped on tomorrow. Big snowstorm.
Yeah.
Crazy.
anyways,
Well,
enough
Anyway,
complaining.
enough of our shenanigans. It
Can
really,
always be
it's
worse.
crazy. Really?
Right. Let's get to our guest, Lizzo.
Can it be worse?
I'm sure it can. It always can.
I don't know. I can't
Possible.
think of too many scenarios.
So I want to announce the first individual here. We have 3 folks on the podcast today. Number 1 is this great brother-in-law of mine, which I call Chili Dog, and his name is Gilles, and he's CMTA's chair of the board of directors. Right on. Hello, Gilles.
Hello, Chris.
Nice. Who else do we have, Lizzo?
Hey, Chili, how you doing?
Doing good, doing good.
Lizzo, who else do we
Good.
have?
Come on, I was waiting for him to say hello. I'm just greeting
come
our
on.
guests.
We
We
don't
I'm
have
looking
time.
up here. It's early in California, so I'm
Yeah,
looking
let's
up
go.
here.
We have Queen Jeana.
Queen
She's-
Jeana.
She's our Seago.
Oh, what is that?
I can never remember her title because it's so long. Like she has to have the longest title of everyone on the staff. Chief Engagement and Gift Officer, Seago.
Nice.
And then we have
Hmm.
the comedic chaos controller, Laurel Richardson. She's
Awesome.
a DACO, the director of community outreach. DACO and Seago here. So welcome to our
Hello.
podcast.
Yeah,
Hi,
welcome
Gilles.
everybody.
Hello. Hello.
Thank you.
Listen, it's
Happy to know Gilles' nickname, Chili Dog.
yeah. I don't know how that started, but
Laura, this is a nice one, when we're in public.
Right,
Great,
right.
rated.
Just
Well,
call 'em
listeners,
Chili.
Listeners, we're extremely excited. You have senior members of the CMTA here today. They're going to give us a lot of insight in terms of what they do, what they have accomplished in 2023, what's the path going forward to 2024, et cetera, et cetera. So without these individuals here, we would not have the CMTA, and they play leading roles to support research, secure donors, drive the science, and every single day fight for a cure for CMTA.
It's pretty remarkable. So I'm going to ask a broad question to Jeana, Queen Jeana. You and I have been involved for a very, very long time in the CMTA. What are the 5 major changes you've seen over the past 20 years?
Oh my gosh, five.
Gosh.
Oh, that's a big question. Holy
Wow.
man. 5 major changes. Well, definitely research in a whole. Like it's just expanded tremendously from the people that are involved on the STAR advisory board. We're international. Our community has grown. We have 2 camps. The staff has grown a little bit. Oh man, geez, oh man, we got through COVID
Good point.
brilliantly. I think that we didn't even skip a beat through COVID. And oh,
Our social
I-
media
I-
platforms, how about that? They have expanded like
they
crazy.
have expanded. Yeah, I think that more people within the community are wanting to get involved with the cause. There's an ownership there, there's a want and there's a need, and they're finding the CMTA in filling those needs. So I think those are the big 5 changes.
Hey, that's a great response, Jeana, for no prep, right? So we did not prep you for that one. So Lizzo, let me just, as we go around here with our panel, back to Gilles. So Gilles, tell me how you've been or why you're engaged in the CMTA and what exactly does a chairman, of the board do? Like, where do you place your emphasis and focus?
Well, you know why I'm engaged, right? It's because of Johan. And when we found out he had CMT, it wasn't the first in the family. So we had to learn and we got engaged and we decided to roll up our sleeves and try to make a difference. And Elizabeth was very engaged for many, many years. Before I got engaged, I helped launch a STAR program because I felt we needed a long-term strategy. And then when I retired from my tech life, the STAR program had grown so much and the organization had grown so much. I think it welcomed me to help to kind of take it to the next stage. And it's been very exciting. And well, what a trip.
Yeah, that's awesome, huh?
As to what the chairman does, I don't know. I try
Delegate.
to be as little as possible, just kind of, as you know, I'm great at delegating, so I try to pick great people and let them run with it. So, and you have a couple of great cases in point here.
Hmm. Well, I'll tell you from my chair, what I've seen, you've brought a lot to the table with regards to the CMTA in terms of moving that research forward and being an exceptional leader for the team there. So, you know, people are very excited to have you and always very positive. And just moving on, Laurel, so tell us a little bit about, you know, what you do in your role and how long you've been part of the CMTA.
Yes, gosh, I joined the staff 5.5 years ago, Chris and Lizzo, but I was a volunteer before that. I helped to lead the San Diego branch for a couple of years. And then when my husband retired from the military, we moved back to Wilmington, North Carolina, and I started a branch there. So really got involved as a volunteer, was very moved by the mission and the hard work of the team, and I wanted to be part of it. And an opportunity came up when Jeana moved over to the development side. So I came in June of 2018, and I spearhead education and community programs. So things like our annual patient research summit, the branches all over the country, and a couple in Canada and Mexico. And our quarterly lunch and learn webinar education meetings, which we're still super excited about. They're going very well. And then youth programming that's led by Jonah Berger. So you've got Camp East and West, you've got the Compass Young Adults Group, the Youth Council that Jonah and his amazing Youth Council members lead. So quite a lot going on in community outreach, which all feeds together to everything that we're doing to support the mission. So it's amazing.
I
Sounds like
can't
a big
believe,
role.
Laurel, that you've only been involved for 5 years. I feel like it's been 20. You do so much, and you've just went in there and you got involved and you made it happen. You're making it happen with community and everything else. I mean, you three are just amazing at what you do at the CMTA. You are just amazing at what you do.
Thanks.
So
It's
Yeah.
a privilege. It's a
You know, I
privilege.
think it'd be great to hear, Lizzo, what I've been thinking about. Oh, and keep in mind, Lizzo, I'll just run this entire episode, okay? So you
Well,
just
that's
hang
fine.
back.
You usually think you do anyway, so go ahead.
All right, so I'll let you know when it's okay to ask a question.
Okay,
I'll
sure.
give you the
wait for
thumbs
your
up.
cue.
All right, cool.
all
Wait
right.
for my cue. No, but it's very interesting. I think of the talent we have here, and you know, of all the positions, you know, you guys with your skills could take on, or companies you could work for. You know, it just makes me think, why are you working for the CMTA? You know, at the end of the day, and I'll just start right there with Jeana.
Why I'm working, I believe in the association, but I trust the leadership behind the association, their vision, their passion. They share, you know, the overall goal of our community, and that is to bring treatment and cure to those living with CMT. I have CMT. My CMT is a spontaneous mutation, and my youngest daughter, who also has CMT, I work for us. I work for the 3 million people worldwide living with CMT. Every single day that I sit down, I'm reminded by every email, every phone call, seeing Riley, why I work so incredibly hard. But I trust the organization as a patient, not as a staff member.
You don't trust the organization as a staff at the
Both? Maybe both.
Well, that came out wrong. But no, when I talk to people, I trust the CMTA, but one of the things I always try to tell people is I too am a patient, and I see the CMTA as a patient. So that's what I mean.
No, that's
Jeana,
cool.
quick question. You've had a lot of ups and downs like everyone. You know, we've had changes in leaderships and things, and there's been hard problems, easy problems. Why are you still here?
Man, because I have a goal, and my goal is to bring a treatments and a cure.
She's not allowed to leave, Elizabeth. That's the only reason.
Okay, all right.
Stubborn, man.
No way.
Quarterback.
So Gilles, you
I
know,
don't leave.
yeah,
What
okay,
about
so
Gilles, what about Gilles and Laura real quick? So Laurel,
why are you guys involved?
right? Why are you involved? Like, what's your passion? What drives you to get out of bed in the morning and go to work for the CMTA?
So I would echo what Jeana said. I'm a patient, third generation CMT 1A patient. From the patient perspective, I saw what the CMTA was doing, the dual mission, the incredible support, everything they were accomplishing in research. And I wanted to be part of it. I literally sat at a branch leader conference for a weekend and thought I have to be part of this team and what you all are doing. It's incredible. But the most driving, the thing that really drives me is no one's going to do it for us. No one, we're a rare patient advocacy organization. We're trying to solve rare disease issues, and no one is going to do it for us except the patient community. So, and that's originally why the CMTA was founded. So if you don't have passionate patients and their families involved, none of this would have happened. And you all are obviously those people who helped to build the organization. So we have to do it because no one's going to do it for us. That's why I'm involved.
So Gilles, I'm going to ask an additional question into, we know why you're involved, but what makes us different from other organizations that are related to CMT? What makes the CMT stand out?
Well, many things, but I think we have two pillars, right? We have the community and the research and the STAR program, and those two pillars really complement each other. So, and with the number one in both areas, STAR has become by far the leading funding program for research, outside of governments. And our share, I mean, someone was showing me a chart like 5 years ago, we were spending like 5% of what the NIH is spending. Now we're spending 25%.
Wow.
So it's becoming hugely important in the whole CMT ecosystem. And that's being fed by the community because all this funding comes from the community because they trust us. Because we're so efficient, because we're highly rated and we work very hard so that 92% of the money people give us goes to our programs. So we have this combination of a very powerful research program and the support from the community that creates synergies together, which are incredibly unique, and you won't find hardly any organization, even in the nonprofit world, as I talk to them. And we got to maintain that. It's incredibly powerful and exciting.
You guys have all referenced trust, and I think about, why you got a lot of these charities, right? And people donate, and generally, I always ask, why would they donate? What happens with the money? And you hear good stories and bad stories, but, you guys have a common word that you say, you reference trust.
Yep.
Really in a lot of aspects of the CMTA. So if any of you guys want to highlight or speak a little bit more about that, great to hear it.
And let me add the other word, transparency. They talk about trust and transparency.
Point.
What does that mean actually in real terms?
Yeah. So trust and transparency.
I'll say a few words and I'll let others jump in, but I always tell people that we're in the business of trust. We're not in the business of everything else. Everything else is just really to earn people's trust. And you're right. What I found out and what people told me, nonprofits, there's millions of nonprofits, millions of charities. A lot of them are great at telling you a great story, but when you look under the cover, that's not what they do. Okay. And I think our strength is basically we do what we tell people. And it's why sometimes we're cautious about what we say, but words come through. And it's why we have these stellar ratings from the agencies, which almost nobody gets, because we basically do what we say we're going to do. And the only way you can measure that, unless you spend hours and hours and hours asking questions, going through all kinds of material, is looking at those ratings like Charity Navigator. And it's very hard to do what we do the way we do it. I tell it's a lot of work, and I'm so proud of what we're doing this way. Okay, but it's all about earning people's trust.
How do you earn people's trust, Jeana, and then Laurel?
Well, I mean, I everything that Gilles said is something that I really try to explain to people that are call into the CMTA. In addition to, the 4-star Charity Navigator, the 100% rating that only 15 other health charitable organizations received, CMTA received that. I try to, express that over the phone, but I think that trust also comes from when people reach out to the CMTA when they're first diagnosed, or their symptoms, there's progression within their CMT and they're reaching out to the association. How can we help them? And we provide resources and information and community, and being responsive to that. I think really pulling them in and making them feel that they're not alone in this journey. And that is something that I really try to give the person, whether it is through email or on the phone. So I think that trust, that the CMTA is there for them in their journey and our community.
Yeah, so you're really out of the gate, you're focused on building a relationship, it sounds like, right? That's probably a big component of how you gain the trust of someone, right?
I
So
think
Laurel, go ahead, Liz.
I was just gonna say, I think providing
no.
solutions to their answers. You have people newly diagnosed, like Jeana said, they're calling in and they're scared and they're upset, and we have answers. But we also do what we say we're going to do. So Gilles talking about that from a big perspective, right? Research, transparency, where we invest our dollars. We do exactly what we're going to say we do. But I'm coming at it from a little thing, like if I get a phone call or email, or Jeana or Jonah does, or anyone on our team, and they say, I'm going to call you back, or I'm going to get you this. We do that. We always have that touch point. We always follow up, and we always do what we say we're going to do. And then slowly over time, as that rapport and relationship is built, then we become that trusted partner when it comes to a patient advocacy group, and providing education, providing answers, pointing out the centers of excellence. They don't even know there are centers of excellence when they're newly diagnosed. So getting them to the right person to get the answers that they need. And then they, like Jeana said, they feel like they're part of something. They part of our family, part of the organization. And it's what we need.
And Lizzo, I heard charity navigator, right? And 5-star. And do you know what that is? I mean, I
don't know.
It's
an
maybe you guys can
organization
explain
that
it.
says if you're good or not. I don't know.
Right. And maybe that's tied to trust or something. I don't know. Who wants to tell us what the heck that's all about?
Not it.
Okay. 5-star. What is this?
It's
100%
measure nonprofit. It's what?
No, I think it's the most respected organization that evaluates nonprofits. There are several of them, but I can tell you from experience, they go much deeper, and they ask us hundreds of questions. They're going to provide all kinds of documents, and they basically evaluate how good you are and using the money that people give you. And I tell you, and they keep raising the bar. It's a very thorough evaluation. And as Jeana said, in the health space, which has like hundreds of thousands of charities, I think there's like 12 to 15 who got this perfect rating, which we have, which, I don't guarantee we'll keep forever, but I think we definitely want to be at 4 stars, which we've been for many years.
So, I've looked up the CMTA and I saw that stellar rating, but I've looked up other CMT related organizations and I don't see anything there. So what does that mean? That if somebody's not on Charity Navigator, what does that mean?
Well, sometimes they might be too small, so they only rate organization, I think it's above $1 million. Sometimes they haven't been alive long enough. Sometimes they don't publish their results, or they're behind. So there's many reasons for that. But I think it's in everybody's interest to be rated, to be honest. There were many years ago, 10 years ago, the CMTA was a 1-star or 2-star. And I think it was a big kick in the butt for everybody to get better. We always strive for excellence, and this is a very good measure for everybody to look at. Okay.
I have a question for you, Chili. Why don't we have a cure yet? So 20 years ago, we're like, we didn't have anything. 15 years ago, we said 2 to 5 years. Now it's 20 years later, we're giving all this money to research. Where in the heck is the treatment to stop the progression of CMT? Why haven't we got there? Listen,
anybody who tells you they're going to cure in 2 to 5 years is lying to you, because they just don't know. Okay, we could have one, but we have to play the odds. And this business is, is crazy. 90% of the drugs in clinical trials fail. Takes billions of dollars. So all we can do is have a very strong, broad strategy which is exactly what STAR is, right? It was, let's put CMT on the map. Nobody cared about CMT 10 years ago, and we created all the elements of the puzzle so that people would care. Not tons of companies, tons of researchers, all the latest technologies now are being applied to CMT. So that's the only way we can guarantee success. We cannot predict the timing. but we can see, basically we build an army, okay? And by the way, you might have heard, but last week, the FDA approved the very first CRISPR therapy. And
Wow.
2 years ago, the top CRISPR people in the world called me and said, we want to work with you on CMT. So that's the kind of stuff would never happen before. But now we make CMT attractive to the very best of the best, and good things will happen. And by the way, as I've told you guys, we're entering what I call Star 2.0. Star 1.0 was to make CMT attractive and make all this happen. We're there. Now, it is a discussion we had with Stefan Zuckner. Remember, he said we're entering the age of therapies. That's happening, where now things are starting to hit patients. We're starting to see clinical trials. It's going to be a long process. There's going to be disappointment. There's other diseases that have been in for 20 years that they don't have treatments yet. So, back to the trust, we're not going to tell you that we're going to have a treatment or this one thing is wonderful, because we just don't know for sure. There will be disappointments. But the overall ecosystem is like an order of magnitude in a different place than it was. And it gives me a lot of hope. But also, we have to have some humility and know that there'll be disappointments and setbacks along the way.
Yeah,
Hey,
you
Jeana,
just said something,
Go ahead.
Gilles. You said hope, and that's, as you were talking, I was thinking about that, whether Jeana, Laurel, but how do you keep people positive and that there is hope given this complex process, right? With trials and the failure rate, et cetera. But, how do you, I'm sure you guys engage with that all the time, right? Someone's like, oh, geez, I don't know if this will ever, I don't know if we'll ever find a cure. I don't know if we'll ever find treatment. And I don't know if I should donate anymore. And so how do you respond to that? It's got to be a real thing.
Yeah, it is. And I think for me, every conversation is very different. But one of the things that I try to hone in on, and Gilles, you may want to expand on this, but I think 15 years ago really is Stark was born, right? So 2008, and starting with one subtype 1A, we had one project going on, and working through the NIH and luciferase. I remember the very first branch meeting that I went to when I started at the CMTA, in presenting STAR, and seeing how the learning. So we had 1A, and then a donor said, hey, I want 2A on that platform, and you all are growing this research project so amazingly. I want to see something for me. And with donor support, we were able to grow that. And then 1B, same thing. And then here we are. But I think the learnings of STAR, it's not that we paused, but so many things had to be in place to where we are today to be attractive. And that involved toolbox. And I think that the toolbox is animal models, stem cell, biomarkers, all of these tools that the CMTA needed to expand. So as there is not necessarily a cure or treatment in place, all of these things have happened in the past 15 years that we have invested in to get where we need to go. And I don't necessarily know if patients or donors necessarily see that all the time, that we're throwing out emails that, we've expanded this and we've expanded that. We had to have those things, and we had to invest in those things to get to where we are today, with all of the pharmaceutical companies that are coming to the CMTA and saying, hey, CMTA, I want to work with you because we have these tools. And so now that we're here, we're really seeing the expansion of all of these, amazing things that are happening in the world of research. So that's how I kind of create that hope that, yes, we're not where we wanted to be 15 years ago, but we have expanded our platform. We've expanded our tools. Now is go time, right? We're on the right path. We have everything that we need, and we have the leadership for it. So I talked to that a little bit, Chris, and really kind of.
I don't think that's a little bit. That's a lot. So that's a pretty little answer. So it was awesome. No, but it's great. It was awesome.
Laurel,
Right?
what
Because
do
you can
think? How do
sense,
Yeah,
as you're speaking, you can sense your emotion and passion, right?
That's right.
It's
Yeah.
fantastic. It's great.
Yeah.
And I'll add one thing to this is what's interesting in this STAR 2.0 that we're entering is the patients are getting more and more involved in what we do.
Right.
You might have heard of something like natural history. You know, we're spending a lot of money doing natural history study because this is what companies want to figure out how the disease evolves to test drugs. Clinical trials, obviously, there's all kinds of research we're doing with the INC on patients. We're doing surveys for companies. We're doing marketing groups so that they can understand people's impact with their CMT lives. None of this was happening 10 years ago. Now we have companies asking us all the time to work with the community, with patients. So people are actually being part of the solution now. And this is what I call STAR 2.0. STAR is reaching into the patient's lives now, which is really incredible. Okay.
Yeah, that's cool. That's great.
Hey, Laurel,
Judy, say
yeah, I would really like to involve Laurel in this discussion, how she gives hope to the community, because you're at these conferences, you build the conferences and these meetings, and how do you keep hope and how do you relay that hope to the people you work with?
I think the way that I keep hope, I am a realist, so I am grounded in realism. I know there's not a magic bullet, but being part of this team, I see what is being built and the momentum and the energy is unbelievable. Hearing the history of how STAR was formed and has grown to this point, and now what we need to do to get across the finish line. And that gives me tremendous hope as a third generation CMTer, hope for my children, hope for my grandchildren if CMT continues in our family. And I think it's listening, truly listening to what's going on in research, trusting the CMTA and seeing the work of the Scientific Advisory Board, the STAR Advisory Board. It's unbelievable. And I think that you can't ignore that energy and momentum that's being built. There's something there. And I visualize, after hearing all the scientists and docs talk about it, I truly visualize a pathway. And so I think about a road in my head and I think of all the things along the way, because this helps me to understand it. You know, the natural history studies, having a community that has to get involved, you know, as patients and partners, having biomarkers, all the outcome measures we need. And I think of our CMTA STAR pathway. And at the end of that is the hope, which is a treatment or cure. And I need to visualize that. And so that helps me keep my hope going, and also just thinking of future generations and myself. I would love to have a treatment for CMT. Yeah.
Yeah, I think, you know, kind of in summary of the hope piece, right? It's, as I'm listening to you folks or thinking about our listeners, right? People have hope when you are connected to individuals like yourself or members of the CMTA that just are committed. They have a drive, they have a passion, right? That's really what you guys represent. And so, you know, obviously I don't have CMT, but being part of that organization in terms of the challenges you guys have, you know, that gives me a lot of hope in terms of what you're working on for the future of those, you know, with CMT, et cetera. So nice work. It's awesome.
Yeah, and I think people need to get involved. A lot of people are angry, I feel, like when I see the Facebook group and stuff. But if you take as much energy in that anger and turn it towards passion and getting involved, we'd be even further in our pursuit of a cure, I think. So what's on the agenda for 2024? What do we got to look forward to?
Whoa, can we back up?
Look at time.
Whoa,
like, we gotta move on.
whoa. What are some highlights for 2023? And 2023 is not over yet. There's Lizzo. That's good though. She wants the future.
I want to know, but that's
one
right.
and done. 2023 is over in her mind. So,
you know, you've spoken with Jeana, because she goes, I cannot think of January 1st, 2024, because I got 2023 to deal with. And what does that mean, Jeana?
Yeah.
Oh
What are
my
some
gosh,
highlights?
what does that mean? That means we got to fundraise, right? I mean, we got to bring the dollars in. We have to bring the dollars in. As a
Write
CMTA,
your check.
Yes, write your check. Yeah, you know, I think that when people are coming to the CMTA and they see, like, the CMTA looks mighty on the outside. I always tell people we look mighty on the outside, but we're very small team on the inside, and we accomplish so very much. but all the research that is coming out, all the programs that the CMTA does, that all needs to be funded, right? And it's our community and their friends, their family that we need. Everybody needs to like rally together in order to get to that end goal. So I still have let's see, how many days?
Well, from the day this podcast launches, let's say 18.
Okay.
12 days?
Yeah, 12 days. I have 12 days to fundraise for the organization, but I have 12 days to fundraise for the CMT community. And I think that is what I always tell people, that, you know, I'm fundraising for us, you know, I'm fundraising to provide research projects. I'm fundraising to provide programs for us. And so yeah, I mean, I got a lot of work to do.
So Jeana, what do you tell me if I go, oh, well, my donors are tired of giving to the CMTA. I'm tired of giving the CMTA, you know, yeah, research, blah, 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 pharmaceutical companies and everything. I have some money here, but I'm not really sure I want to give again to the CMTA. Why should I give again? Pitch it to me.
Why wouldn't you want to give to the CMTA again? I mean, I think that
Puppy on this envelope here.
I'm sorry.
It's a cute puppy on my envelope, the Humane Society or something, you know, it's really, really cute.
Well, if you don't give, who is going to give to the association? You know, I think it's us as patients that are the driver in the end goal. And what is the end goal? So I think I would ask you that. The CMT in general is not very well known. We're not the American Heart Association or the Humane Society, because they have a broader reach. People know about them, and you know, their campaigns are much larger on a bigger scale, because they have the people. The CMTA and CMT, we have our community, and it's our community that I ask to, one, support the cause, but then they have to ask others to support us. So if you choose to give to the Humane Society, that is fantastic. But I ask you also to consider the CMTA, because without your support, we can't do what we do.
Yeah,
Laurel,
Lizzo,
what do
you know,
think? Go ahead.
and the other thing I think about, right, you know, when you're at mom's house, it doesn't mean, you know, I don't support this, right? But she gets a lot of things in the mail with regards to donation, tons. You know, and I read through that, let's say it's for animals, et cetera, which I would support, but there's not that strong connection. You know what I mean?
Yeah,
So
there's
I think
hundreds of places. Oops,
yeah,
sorry, Chris.
so many places you can donate and put your money, right? And there's so many great causes, but I think, you know, from my perspective, what's different with the CMTA, there's that true, you guys work so hard to make that connection with the community, right? It's much more than just a newsletter or a request for a donation that goes out via email, right? You guys really make that connection, and that's critical, I think, to the success. So Laura, what were you going to say?
And I think it comes, you know, everything Jeana said, and it comes back to no one's going to do it for us. It has to be us. So there are millions and millions of people who are going to give to the American Heart Association or the Cancer Foundations or the Humane Society, but only people with CMT who are affected and their families are going to support our cause. So it has to be us, and we need them. We can't do it without them.
Yeah.
You know, a lot of times fundraising is an emotional response to something you see. Is there anything you can think of this year or last year that you've seen, maybe at camp or anything, a real reason why people would emotionally say, hey, I got to give to the CMTA? Kids, camp, anything.
Connections, stories.
You know, for me, was the summit this year, and obviously camp. But one of the things that I saw at the summit was there was an energy there that, you know, people are hungry for just meeting others living with CMT. There's so many people that have never met another person living with CMT, and being around that, and the CMTA giving that, and you know, to our community, providing a space for that. I think that there's a want and a need there. But at camp, I mean, there's so many stories, and I love telling the story about, I went to a branch meeting and I presented the CMTA, and we were talking about camp and talking about research, and she came over to me and she said, Jeana, if there's a treatment for CMT, does that mean camp stops? Like, you know, because she has a place of comfortability and a place to grow her confidence. So there's so many stories.
Yeah, I think Jeana stole my answer. So camp every single year, hands down. I mean, the confidence and independence that is built in that 1 week at camp lasts those children the entire year. They can now walk into their classrooms with their heads held high, and they feel more confident because they know they're part of a tribe now. They're not alone. They've learned, you know, they've learned more about CMT. We don't sit around at camp talking about CMT. It's summer camp. We're having fun, but they learn more because they're there and they have answers to the questions, and they learn how to talk about it, and they learn how to be in the world with CMT and be different. And so that's incredibly wonderful. But mine also came out of the patient summit in Boston. I was sitting talking with a woman who was similar in age to me. We were both 19, and she had come all the way from Western Canada. And this was her first time, she's in her 50s, her first time ever meeting someone with CMT. And she just cried. She sat there and cried. And she couldn't believe everything she had learned, but more importantly was all the people that she met, and she knew she was going to be okay. And it was really special.
Yeah, that's great.
Yeah.
Chili, you have any emotional connections here in 2023?
It kind of spans the whole spectrum of what we do. I mean, on the star side, I mean, I could tell you dozens of phone calls with top researchers, top companies who call and say, oh, you know, we want to work on CMT now. We want to work with you guys. We love what you've done. We want to use your toolbox. We want to, you know, we want to talk to your patients. I mean, none of that was happening 3-4 years ago. Now it's happened on a weekly basis. So, you know, every one of those, you know, I do backflips in the office here because that's the whole strategy that's working, right? Yeah. And then obviously camp and the summit were incredible, the energy and everything. Except that when I arrived at camp, I got inundated and sprayed with all kinds of material. Right? So I got a very warm welcome by everybody. So I will never forget.
Was that silly string?
Whatever. I mean,
nice.
For the whole day, I can tell you. And then, and the, you know, the kids are incredible. They are so positive, you know, and they are so mature and so professional. I mean, they are future. So both at camp and the summit, I love those engagements. The energy. I mean, I think we were all overwhelmed by the summit, by the attendance, by the energy, by the positivity, by the reaction. So, you know, the post-COVID years are really exciting. You know, and last but not least, frankly, is our new CEO, our new leader. I mean, I know.
Tell us about that.
Podcasts on that. But
that's right. You do have a new CEO.
Who is that person?
I mean, you know, Sue, and you'll get to meet her. I'm sure you'll do an interview with her. I mean, the single fact that we're able to attract someone of her caliber and of her quality to work on CMT, I mean, that would never happen a couple of years ago. I mean, you know, here's someone Harvard and MIT educated, you know, has been part of bringing drugs to market, has been the CEO of several biotech companies, also happens to be a very nice person and a great manager and very attentive to people and patients. You know, the fact that we could get someone like this to join the CMT community and lead the organization is incredible. It just shows that we're on a different level. So that was a great way to end the year, I can tell you.
Yeah,
I also heard you have a new employee.
Yep.
Has this been announced?
Yep.
Kenny B was just hired as an employee of the CMTA. So
we had Kenny on the podcast. He was great.
We had Kenny on the podcast before. So congratulations on that.
Will that
So-
be announced by the time this is out?
Yes.
Yeah. I hope
Gonna be,
so.
because I just
So-
announced it. I know you guys are just like, no one.
Yeah.
Oh yeah. Oh,
Good
Jeana,
rehearse.
we heard you have a new role. Carl, that you're well, wait a
Well, I
minute.
can't believe
guess we
you're gonna
can't
be
say.
doing that next year.
Right.
Talking
Yeah.
about next
Unbelievable.
year, quickly, what are
Right.
our plans for 2024? I'm
There
dying.
you go. I think we answered the 2023. I don't know, but Lizzo,
Got our
you're pretty
hand up
good at
that
that. I asked a question and somehow we go all around. I think we got it out, but
Wait, can I add one more thing from this year? I'm sorry.
No,
This is
go
very important to me. Okay.
yeah.
So,
go ahead.
one of the things that the CMTA does is when we're working with a pharmaceutical company, whether that is a pharmaceutical company that we've had a strong relationship with over the years or a new pharmaceutical company, the patient's voice, as I think Gilles and Laurel both have mentioned, but the patient voice has been an critical part in researching and advancing research. So we worked with a focus group. We did a focus group this year, and it was for, I believe, 2C. And on this focus group, it was, I have never heard patients be so open and share in the way that they did. The vulnerability and just the honesty and the passion to share their story. I was crying, and so was the pharmaceutical company, and I will never forget that. And that is why I think that for patients to really make sure that they sign up to be a patient as partners in research, so that they can too participate in focus groups where their voice could be heard, and in addition, possibly participate in upcoming clinical trials. So I just wanted to share that as well.
No, that's great, Jeana. Thank you. All right, on to 2024. What can we and our listeners expect from you folks?
3 items each. Let's go.
I'm
Whoa.
happy to jump in. Okay. Patient and Research Summit in Denver. Be there for the connection, the camaraderie, the education, managing CMT, for the STAR research update. Be there to meet the clinicians, the scientists, and the team. Be there. If you can't be there in person, join us hybrid. We will offer it hybrid so that our friends from all over the globe can join virtually.
What's the date on that, Laurel? Do you know?
That is, we're doing a weekend now. We are experimenting with a Saturday and a Sunday. So Saturday,
Okay.
September 7th and Sunday, September 8th in Denver, beautiful Denver. Who doesn't want to be
Nice.
there in September? And then we're going to continue with our Lunch and Learn webinar series, education, quarterly meetings virtually, which has been wonderful. And one new thing we're launching, and Elizabeth, I know you're going to be really excited about this, is we're going to take the emotional support group that's on our website, and we're going to do an online virtual emotional support group where you come to a meeting and you get some of the emotional wellness and mental health wellness tips that you need, or just for the time to talk with others who have CMT. So we're currently building what that group would look like, and we'll share more information in the new year.
Love it.
Nice.
Love it.
Okay. Ooh, right
Great.
to the point. All right.
Jeana. Hey, Dogger.
Okay. Coming on my end to 2024, asks to donate. No,
Okay.
Donate.
There'll be, community walks and cycles. People can look forward to either participate, or someone can host their own walker cycle in their neighborhood. Again, asked to support the CMTA and individuals' causes. And one of the things is, if anybody out there knows of a foundation that offers grants to like programs, whether it be camp, the summit, or maybe even a grant to support the research in a whole, I would love to know about them. The CMTA, we're looking for more and more foundations that could possibly support us. So yeah.
Cool.
Okay. That's awesome. And Gilles, how about yourself as the chairman?
Well, on the STAR side, I could talk for hours, but I think there's two major things. I think as Jeana said, we need to raise more money because there's more and more demand, especially on the clinical side, because more and more drugs are going to hit the clinics, and we're not quite ready. We're more ready than ever, but there's still some work to do. And the NIH funded a lot of this, and so did we. But the NIH, a lot of those funds are ending, and so the CMTA will be taking over a lot of this clinical preparedness funding, and nothing could be more important. Because we can have all the great results on rat and mice. It doesn't matter if it doesn't go to people. Okay, and that's what we're going to be working on, and that takes a lot of money and need a lot of support. And the other thing is we're going to see more and more of those genetic therapies progressing, whether it's RNA therapies, traditional gene therapies, CRISPR. There's a lot of activities. I can't predict exactly the result, but there's milestones that are really important in the next 12 to 18 months. And I'm sure some of those will be disappointing, but many of those I think will be positive. We'll see great progress. So if you combine that with the development of the clinical stage, you can see why we're in a whole new phase of STAR. Okay.
Yeah, awesome. Looking forward to 2024. Right,
Great
you guys
job,
have
guys.
a lot of great things going on, which is awesome. Just awesome.
I feel
I can
pumped
tell you,
up.
it won't be boring.
I know, I'm fired up now.
Let's go. Let's do this thing.
No
Yeah.
rest for the weary, people. No rest for the weary.
Yes.
Well, Chris, I think we should be wrapping up, but we
I
do
do
have a
too.
couple of questions. Do we have a time for those questions?
Yeah, I think so. Yeah,
Okay.
definitely. And because we can make up time, I'm sure the producer will edit out all the things that you've said. So we probably have 15 minutes back to us. So.
I was just gonna say the same
If
thing.
you bleep all the swear words and all the things that are not supposed to be announced, you get an extra half an
Yeah,
hour.
it'll be like a 35-minute podcast. So there you go.
Go
all
ahead.
right.
You can ask the first one.
I'll ask the first one. This is for Gilles.
Uh-oh.
Okay. Gilles, what is your biggest pet peeve?
Oh, jeez.
In life,
However you want to interpret that.
basically, I'm a very impatient person in a very slow-moving world.
No, really?
This drives me nuts. I know.
So you
Yeah.
think the world is moving too slowly?
Especially the world of CMT research. I mean,
Mm.
compared to everything
Nice.
I've done in my life, this is so slow and so difficult and so
Yeah.
expensive. But that's why we have to be so strategic, and I think that's what we've done. You got to build a breadth of ecosystem. But sometimes it'd be nice. Oh, let's just do this thing and make it work. It's not how it works.
Right.
Again,
Okay.
every tell for that is just basically bullshitting it. Okay.
Right. Okay. And one more.
Right.
Sorry, I have to ask this because this came up too. So, Gilles, if you were a car, what type of car would you be?
Well, when I was young, I would be a race car. Now, I wouldn't say I'm a minivan, but I'm probably.
All right. There you heard it, folks.
So he's a minivan?
A race
Is
car
that
to a
it?
minivan. He's getting
Ask me
older.
If I was a bike, at least, I'm a car.
Yeah, there you go. Okay. We'll move on. Lizzo, go for it.
Hey, Jeana, if you could have a lifetime supply of anything, what would it be?
Mm.
Oh my gosh. Terrible, these questions. Lifetime supply of
Anything.
Toilet paper.
ketchup.
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 Oh, I thought
I
you'd say like
love-
Reese's chocolate and peanut butter or something. No.
Nah, I love me some ketchup.
Okay.
Well, you're
Yeah.
going to be getting some bottles of ketchup for
Yep.
Christmas.
To our
Yeah.
listeners.
Jeana, some ketchup. All right. Those little packets, big bottles, everything.
Yep.
Can
Let's-
never have
let's-
enough condiments.
Let's promote our mailing address, Lizzo, and see how many of our listeners will donate cases of ketchup to Gina's house.
Or glitter. I should have said glitter.
Glitter. There you
No,
go.
it's ketchup.
So-
Lizzo, you want to ask the last one?
No, you can.
All right, Laurel.
Hmm.
Truth.
Have you ever made a prank phone call?
Oh, yes, absolutely. Several.
Oh,
Tell us about one. Tell us about one.
you remember
Oh
one?
my gosh, when we were little, we would, you open up the white pages and you
Oh,
start
yeah.
calling people and you say, I mean, we were like, what, 7, 8, 9? And we'd say, is your refrigerator running or something? And they'd
Right.
say yes. And you'd say, oh, you better go chase it. Just ridiculousness. But yeah, I loved a prank phone call.
Did
Awesome.
you
You
ever
found
order pizzas to play people's houses?
Have I what, TP'd?
Ever sent pizza to people's houses?
Oh, no,
Oh
no.
my goodness.
I
No.
have.
I have TP'd a house. This is like a confessional for a reformed Catholic.
Yeah, here you go.
I
That's good.
love it. I love it. I know you have
Right.
a little prankster in you.
Well, listen, Joe, were you going to say something?
I say it's group therapy.
Yeah.
Yeah.
So I guess in summary, Lizzo, and for our listeners, and feel free to comment, but the message here is these are real people, folks. These are real, solid individuals that are driving every single day. They're committed to finding a cure. They're committed to communicating and building relationships with those with CMT and others, driving research, and just an exceptional support group. So I think, Lizzo, what are your thoughts? I think that came out very well today.
Yeah, I want to thank you. And what struck me most was that donors and patients and volunteers, they're not just donors, patients, volunteers, they're family. And we're doing this for our family. CMT is a big family, and that makes me really emotional, but I've seen it and you've talked about it, and that's who we are. We're family.
Awesome. Awesome.
Yeah.
All righty. So, hey, Lizzo, if someone wants to follow us on social media, where do they go?
Well, we have a Facebook and an Instagram page, CMT for Me Podcast. We also have a YouTube channel, which is called Raw and Unedited, as well as our brand new TikTok channel, CMT for Me.
Oh, my
And
goodness.
that pod page thing,
Yeah.
www.podpage.com/CMT for Me.
Okay. And you just said it. So to our listeners, if you have a good story, we'd love you to reach out to us and tell your story on our podcast, and either write to us at info@cmtausa.org or pitch your idea, or go to our new website, like Lizzo just said, www.podpage.com/CMT for me, or fill out our inquiry form on cmtausa.org.
And we also have a phone number if you want to call in and tell us about a story or tell us about somebody you'd like us to interview. Now, the phone number has changed, so I am going to give you the new phone number.
Okay, write it down, folks.
941-231-1352. 941-231-1352. Give us a call.
Yeah. And don't forget, leave us a review. We say
Please.
that all the time. Please leave us a review. And you can leave that review by visiting Apple Podcasts, or go to Podpage and leave it there.
Chris, we did get a review. I don't have it in front of me. I wish I did. It was wonderful. She said, I have finally found a place that people I can relate to, and people that give me positivity, encourage, and motivation to continue every single day. It was a wonderful, we'll read it next time.
Oh, that's cool.
Yeah, no, it was awesome. It was so.
Oh, I just noticed. I just got a review. It said, Chris, you're unbelievable on that podcast. We can't wait to continue to listen to you in 2024. So it was awesome.
And
Thank
they
you.
also told you to boot your sister because you're really a star.
Yeah. And
Yeah.
they just said, it's amazing how you single-handedly keep this podcast going.
Oh, was the reviewer based in Vermont?
That is very good. All right, folks. Well,
Thank
until
you. Good
next
luck with
time.
Yeah.
Yeah,
Well,
looking
yes,
forward to
thank you.
2024. All right.
And good luck in
Thank you.
2023. Give to the CMT. We
Yes.
love you guys. Thank you so much for your time. And thanks, Chris.
Thanks, Lizzo and
All right,
you.
folks.
Thank
Bye,
you.
guys. Adios.
Adios.
Bye. Good luck with your blizzard.
Yeah,
Yeah.
thank you. Bye.
It was
Bye.
fun.
Okay.
Oh, Jill just gets off. Everybody
He's
just
done.
gets off. Like, what
Needs
the
to
heck?
hang
We
Yeah,
don't
see,
hang
this
up.
will be on the
I-
podcast. Yep.
Like, where they
Jill's
go?
like, I have to go biking. Oh my God, it's 12:06. I need to go biking for
do.
my 10th time this week. I've only biked
I
600
thought we were
miles.
just saying bye for the podcast. I wasn't
Yeah.
sure if we were hanging up.
No, I'm like, where'd
Yes.
Laurel go? She was the
She's
last
done too.
last to come
Hey.
on, first to get off.
Hey, Laurel's got things
Let's
to do.
keep
It's
this part
Sunday.
on the podcast to show real dedication here. You know,
Exactly.
here I am. I stayed on.
There you go.
That was funny.
All right.
We didn't
Everyone's
tell
just like,
them
I'm
they
out of
could
here.
go.
Well, it is Sunday. I got to go as well.
We all
Later.
have to go. Thank you so much. That was great.
Later, losers. Happy holidays.
Bye.
Bye.